Anatomy of orifices and valves of the ventricles. First of all, we'll discuss orifices and valves of the right ventricles. First of all, the right atrioventricular orifice, or it is called also mitral orifice. This orifice is oval in shape, situated between the right atrium and the right ventricle. Its plane is vertical plane, and this orifice is directed downward and to the left toward the apex of the heart. This right atrioventricular orifice allow the passage of the tip of three fingers. Each atrioventricular orifice surrounded by a fibrous ring. This ring, each atrioventricular orifice and each orifice in the heart is surrounded by a fibrous ring. This fibrous ring gives the attachment to the cusps of the atrioventricular valve, which here is the tricuspid valve. The tricuspid valve, from the name, it has three valves. Valve attached to the anterior wall of the ventricle, called the anterior valve, or anterior, cusp, and a cusp attached to the inferior wall and called posterior cusp, and a cusp attached to the interventricular septum. Therefore, it is called septal cusp. This is a top view from the atrium to the tricuspid valve, which has three cusps. Anterior cusp attached to the anterior wall of the ventricle. Posterior cusp attached to the inferior wall of the ventricle. And the septal cusp attached to the interventricular septum. What is the cusps of all these valves? All cusps of the heart, of any valve in the heart, is actually a fold of endocardium containing a thin layer of fibrous tissue. And all cusps of the heart are non-vascular except the peripheral 2 or 3 millimeters. Each cusp in the heart, right or left, of any valve, the cusps have bays attached to the fibrous ring surrounding the atrioventricular orifice, and it has a free border which gives the attachment to the chorda tendini of the papillary muscles. The free margin of each cusp is attached to chorda tendini arises from two papillary muscles. Therefore, each cusp receives chorda tendini from two of the three papillary muscles. In the right ventricle, there are three papillary muscles. Each cusp receives only chorda tendini from two papillary muscles of these three muscles in the right ventricles. Each cusp have two surfaces. Surface above, which is atrial surface, and it is smooth. And there is a ventricular surface towards the ventricle, which is rough. The ventricular surface is rough due to attachment of chorda tendini to the ventricular surface of the cusps. The next orifice, which is the outlet orifice of the right ventricle, is the pulmonary orifice. The pulmonary orifice is circular, and it is situated horizontally at the upper end of the infundibulum. This pulmonary orifice lies between the right ventricle and the pulmonary trunk. And also, this orifice is surrounded by a fibrous ring, which gives the attachment to the cusps of the pulmonary valve. What is the pulmonary valve? The pulmonary valve consists of three semilunar cusps. Three semilunar cusps. This is the pulmonary valve. Consists of three cusps, and each cusp is semilunar. Semilunar cusp. In the pulmonary valve, there are three semilunar cusps, one anterior and two posterior cusps. This is the one directed anteriorly and two directed posteriorly. The cusps form with the wall of the pulmonary trunk a pockets. The cusps form with the wall of the pulmonary trunk pockets. And the root of the pulmonary trunk. The root of the pulmonary trunk is slightly dilated above the cusps, forms three slight dilatations called the pulmonary sinuses. The free margin of each cusp. The free margin of each cusp should be directed upwards into the lumen of the pulmonary trunk. The free margin of each cusp present a thickening in its middle. This thickening in the middle is called nodule. And the two crescentic margins on both sides. The two crescentic margin of the free border is called lineule. Therefore, this is the free margin. The free margin of each cusp. The free margin so fibrous thickening in the middle, in the center, called nodule. And on both sides of the nodule, This edge is called lunule. The three nodules are very important. The three nodules are very important to provide a central mechanical support for proper closure of the valves of the cusps of the valves during diastole. This is the pulmonary orifice and valve, and tricuspid orifice and valves, and these are the orifices and valves of the right ventricle. What are the orifices and valves in the left ventricle? As the right ventricle, first of all, is the left atrioventricular orifice. Left atrioventricular orifice, which is called mitral orifice also. This orifice is circular, and this orifice lies between the left atrium and the left ventricle. It is vertically situated like the tricuspid orifice. The tricuspid orifice, which is the inlet orifice of both ventricles, are situated vertical, while the outlet orifice, which are pulmonary on the right side or aortic on the left side, are situated horizontally. The inlet orifice from the atrium to the ventricle on both sides, in the right and the left side of the heart, are situated vertically, while the outlet orifice of both ventricles are situated horizontally. What is the direction of this orifice? This orifice is directed forward and to the left. That is to say, like tricuspid orifice, the orifice is directed towards the apex of the heart, downward and to the left. This orifice, which is the left atrioventricular orifice or mitral orifice. The mitral orifice allow only passage of the tips of two fingers. This orifice, like tricuspid orifice, is surrounded by a fibrous ring, and this orifice is surrounded by fibrous ring, which gives the attachment to the base of the cusps of the mitral valve. What is the mitral valve? The mitral valve is a valve consists of two cusps. Therefore, there is another name for the mitral valve. Because mitral valve has two cusps only, it is also called bicuspid valve. The bicuspid valve or mitral valve consists of anterior valve attached to the anterior wall of the ventricle and the posterior valve or posterior cusp attached to the posterior wall of the ventricle. This is the mitral or bicuspid valve, consists of two cusps, anterior cusp and posterior cusp. In this drawing, the direction of the cusps are not very accurate. What is the cusps and these valves? The cusps of these valves, like the right side, each cusp consists of a fold of endocardium, containing thin layer of fibrous tissue, and it is non-vascular except the peripheral 2 or 3 millimeter. Each cusp has a base attached to the fibrous ring around the orifice, and it has a free border. The free border gives the attachment to the chorda tendini from below, and the free border or free margin of each cusp receive chorda tendini from the two cusps, anterior cusp and posterior cusp, receive chorda tendini from both papillary muscles in the left ventricle. Each cusp has atrial surface and ventricular surface. The anterior cusp has two smooth surfaces. Both surfaces of the anterior cusp are smooth. Ventricular surface is smooth. Okay, no chorda tendine. Below, why is the inferior surface smooth? The anterior cusp, the chorda tendini is attached to the free border only. No attachment of chorda tendini on the ventricular surface of the anterior cusp. Therefore, the anterior cusp is smooth on both sides, atrial and ventricular surface, while the posterior cusp is smooth only from the atrial surface, but the ventricular surface is rough because it gives the attachment to chorda tendini. This is the first opening and valve, mitral valve, and mitral orifice. The outlet orifice is aortic orifice, which is circular as pulmonary orifice and circular as the mitral orifice. Therefore, you can write on your paper, all orifices of the heart are circular except tricuspid orifice, which is oval. The aortic orifice, like pulmonary orifice, directed horizontally. Directed horizontally and just above at the upper end of the aortic vestibule. And this opening and valve between the left ventricle and the aorta. The valve and the opening here is surrounded by a fibrous ring, and this fibrous ring gives the attachment to the cusps of the valves. The aortic valve has 3 semilunar cusps, like pulmonary valve. Aortic valve and pulmonary valve have 3 semilunar cusps, but the difference here, in the pulmonary valve there are 2 anterior and 1 posterior, but in the aortic valve there are 2 posterior and 1 anterior. 2 posterior aortic valve and one anterior. We should notice that the semilunar valve of the aortic, the semilunar cusps of the aortic valve, is similar to the semilunar valves and the cusps of the pulmonary valves. The cusps forms pockets with the wall of pockets. These are the semilunar valves. Form pockets with the wall of the aorta. And the root of the ascending aorta show dilatation just above these valves. The root of the ascending aorta presents 3 slight dilatation above the cusps of the valves. These dilatation called aortic sinuses. And the free margin, the free margin of the cusps are directed upward towards the lumen of the ascending aorta. Finally, similar to the pulmonary cusps and valves, the free border or free margin show central fibrous thickening called nodules, and on each side of the nodule this area is called linule, and also this thickening is essential for proper closure of the aortic valve during diastole. These are the orifices and openings of the right and left ventricles. Thank you for good listening and good luck.